that is a form of sexual
Yeah.
release. And so when we think about like mental health and like stress and clutter, one way to actually feel better
Uh-huh.
and release that tension or that stress that you're feeling is actually to have a sexual experience. And so, like you may think that you're not mentally there or
Mm-hmm.
that you can't get there. And that
Mm-hmm.
is very true. That is very real. And I'm sure you probably have some steps about or some tips about how
Yeah.
to remove those or block those things out.
Welcome to Journey to Joy Live. I'm your host, Dr. Enjoy. Welcome to week 31 of the podcast, and I have an amazing special guest this week, Dr. Ashley Towns. She is a sexual health researcher from the CDC. Because we're going to talk about this week, enjoy sex again beyond the mental clutter. So, Dr. Towns, can you tell us a little bit about yourself?
Yeah, so thank you for having me.
You're welcome.
My name is Dr. Ashley Towns, and I do a lot of public health things, primarily in the sexual health field. So I am currently working, like you said, at the CDC or the Centers for Disease Control in sexual health. I've been in this field for about 15 years or so. So I've
Wow.
worked state health departments, county health departments, and now I'm at the federal level. But all of it has been in the sexual health space. So doing research, doing health education,
Mm.
doing disease investigations, doing a little bit of health policy. I've kind of covered almost all of it. And right now I'm kind of in the epidemiology space, but I've covered a lot of the different sectors of public health.
That is awesome. I'm so glad to have you here. It's February now. So, really, we're just jumping right into sex. Usually, you might want to start with relationships and then love, but we're going to get into relationships and love later in the month. But we're just going to start out talking about sex. Why not? A lot of times, when people get into their field, they might have some type of personal experience. I'm a psychiatrist. So, there's mental health in my family, mental health issues, and, there's some type of personal story. You don't have to tell a personal story if you don't want to, but how did you get into the sexual health space?
It's really interesting because my personal health story is actually that I wanted to be in health.
Hmm.
Uh, I wanted to be in nursing. When I was in 10th grade, my Nana, so my mom's
Hmm.
mom, my maternal grandmother, she died of complications of diabetes. And I
Oh.
had never heard of diabetes. So I started taking anatomy and physiology. I started being really interested in public health, which I didn't know it was public health at the time. I just knew it was health.
Hmm.
So I entered college thinking I was going to be a nurse. I went to nursing school for about 2 years,
Hmm.
started my clinical rotations, absolutely hated them. I mean,
Ah.
absolutely hated being in the hospital, putting on my hand sanitizer before entering a room, before touching a patient, before leaving the room, before taking notes, wearing the white scrubs, which lets everyone in the hospital know that you're a student.
Mm.
It was just not for me. And I was also 18 years old at the time. I was dealing with a lot of things personally. My
Wow.
brother was in the war with
Mm.
that we had with Iraq after
Hmm.
um, 9/11. And so it was just a lot going on and I was stressed out. And I still wanted to be in health, but I didn't want to be in the hospital doing what we call like secondary prevention, like when someone is already experiencing something.
Right.
I wanted to do primary prevention, which is like preventing something from happening. And so I started working on my campus as a peer educator, and I started learning about different topics like nutrition,
Hmm.
exercise, homesickness for people who had like moved away from home to be at college,
Hmm.
sexual health, alcohol, drug use, like all of these different things. And we would give presentations on campus to fraternities and sororities, to
Oh,
first year
nice.
students, to anyone who basically asked for it, like health classes. And I started to realize that we were in college and we thought we knew about sex, but we knew nothing. We knew
Mm.
absolutely nothing. A lot of us had only had one health class, like maybe in 10th
Sixth
grade,
grade. Yeah.
and we were all adults. According to the government, we were adults, but mentally we were not adults, and we did not know what was going on. The rates of STIs were really high. They still are really high, but they were really high in our population. And by our, I mean Black, right? Black and brown
Yeah.
people.
Hmm.
We had the highest rates of STIs, HIV, syphilis, and I just was like, what is going on? Like, why is no one talking about this? Why are we shying away from it? We don't have to worry about parental consent to talk about these things like in
Hmm.
school. So let's talk about it. And I just honestly fell in love with the communication of like talking about it, providing a safe space for us as college students to talk about it, making kind of like destigmatizing condoms and
Right.
destigmatizing the interaction between, us and the doctor. You go from a pediatrician to, an OBGYN for the
Hmm.
first time and like talking about that experience and how it can be somewhat uncomfortable and awkward and then how do you talk about birth control in those settings? So I really just kind of fell in love with talking about things that other people were uncomfortable talking about
Ah,
and
yes.
found a space there. And I just ran with it. Like no one was talking about it. It was very strange for me to tell my parents that I wanted to like
Hmm.
have a job doing this.
Yeah.
We never talked about it at home either. And we didn't talk about it in church. So like we never talked about it and I saw that as a problem. And that's really how I got into this field, stayed in school for my bachelor's in health education,
Hmm.
got my master's in public health, and started working at the health department after doing some health education in our city. Then I got frustrated with that and was like, I'm going to go get my doctorate because we need
Yeah.
more and we need more data. And why is this happening? And where's the equity? And now health equity is like a big buzzword, but at the time it really wasn't. So that's kind of how I got into sexual health and why I'm still here.
That is awesome. I mean, it's a similar story with mental health in general because there's the stigma, and I talk about that all the time, how we got to get comfortable talking about uncomfortable things, and sex is included. People
Yeah.
feel kind of weird talking about it, like it's super personal. I even have patients. Hey, my medications unfortunately create sexual side effects. So they might feel uncomfortable talking about those sexual side effects. But so I try to, make them feel as comfortable as possible because we're all having sex. There's people in the world because we're all having sex. So we got to get comfortable talking about it and then talking about whatever details or however, making sure our sexual health is healthy. That makes sense.
Yeah.
So thank you so much. I have found that with sex, like everything else, with trying to focus on work, trying to focus on a relationship, trying to focus on a test, driving, whatever it is you need to do, stress affects sex the same way it affects everything else. So if your mind is cluttered, and I even read about if your house is cluttered, that can affect your sex life too. So anxiety, depression, lots of different things, whatever is stressing you out or cluttering your mind, that can affect sex and affect your pleasure and enjoying it. A lot of times we might hear about Black women in general, they just don't enjoy sex. It's like a chore. They do so many roles, right? Their wife, their doctor or nurse or whatever their job is, and then they're also mom and sister, grandma, and they have multiple roles. And then it's like, oh wait, I have to pleasure my spouse too. So it can be a lot. But before we jump into how we can actually, get rid of our mental clutter, do you have any common statistics about sexual health in the Black community, whether Black women, Black men, and what should we know? What do we
So
need to
you were right up my lane. You were right up my lane. So I have written several papers
know?
that have been published in the Journal of Sexual Medicine or other journals that kind of talk about some of the positive aspects of sex because for so long we've talked about the negative things like the stereotypes and how that makes Black people, especially Black women, look, that we're hypersexual and that we are
Mm,
super risky and that we engage in all these behaviors, which is why we have high rates of sexually transmitted infections or STIs, higher rates, among all women of HIV. And while those statistics are true, there's so much more to it than
mm,
just being a Black woman. It has a lot of social, cultural, economic, like all of these factors play a role
mhm,
and why the rates are so high and also healthcare and the type of healthcare we receive, the pockets of like we talk like how we know that there are food deserts, there are some
mhm.
deserts of specific types of healthcare or the quality of care. And so those have an impact on our rates as well. But
Wow.
as far as my work, I kind of like said, we're going to leave that to the side and we're going to talk about some of the positive things. Like, what types of activities are Black women engaging in? What is
Mhm.
pleasurable? How, what is their pleasure rating? What is their, how many are saying they have an orgasm? Who are their partners, male?
Yeah.
Are they steady partners or short-term partners? Because we always hear about hookup culture and like, what does that really look like? So that's what I have data on.
Oh,
Um,
nice.
and so we know that Black women actually do report that they have pleasurable sexual experiences,
Nice.
and that they do have orgasms, that they are able to enjoy multiple types of experiences like kissing and cuddling, which are the most popular sexual activities that that Black women say they engage in. And so, like we do have data to sort of combat a lot of the things that we hear.
Hmm.
Black women are not, as risky as a lot of the data has, told us. Those are very specific populations that they're reporting on. So one thing that I try to remind people is that when we talk about data, when we talk about statistics, we need to know the population that they
Hmm.
surveyed or they asked,
Yes.
because to generalize Black women is really unfair and inaccurate.
Hmm.
Because if you're saying Black women are engaging in these behaviors, well, who? Did you ask these people in this specific city, of this specific age range, of this specific economic
Ah,
group, or did you ask people across the US of all different age ranges and all different, subcultures of Black? And then you're talking about the data, right? So, like,
hmm,
that matters. And so, a lot of the work that I've presented on is national data. So, we've
okay.
asked women across the US living in
Nice.
different regions. We don't know all of their backgrounds, which is great
Uh-huh.
because women aren't the same. We have different backgrounds. We make different amounts of money. We have different levels of education. But when it comes to our sexual experiences, those things can have an impact, but they shouldn't determine what we decide to do with our partners. And so we see that when looking at national data,
Hmm.
we have more than two-thirds of Black women who say that they have pleasurable sex.
That's
And,
news to
you
me.
know, that right. So
I
that's
thought it was the opposite, that 60% weren't having pleasurable sex, but I can't remember
no,
what that source was and when that was.
no. So we have we have over 60% of Black women saying that they've had either quite or extremely pleasurable sexual experiences. We have about two-thirds of Black women saying that they had an orgasm. And these are women from ages 18 all the way up until like their 90s.
Wow, that's great.
And
How
so
many? How many were in the study? Or
we
or how
have,
many were asked?
let me go back and look just to give you.
And you hear
uh,
that, folks, up into your 90s.
Yes. So for this part of we had close to 1,000 women in this study, and for those who answered the questions around their pleasure rating and their orgasms, we did have fewer women who answered that question. It was a little over 600, and the reason why is because we were asking about their most recent sexual experience, and
Mhm.
some women reported that they hadn't had sex recently or like within more than a
Okay.
year. And some of that is due to age. So as women age, sometimes they engage in less sexual experiences, which
Mhm.
makes sense because their bodies are going through different things. We go through menopause, and if they have any sort of health condition, that may have an impact if they are postpartum or going through, different things with their bodies that's changing after childbirth. There may be periods or pockets where they don't have sex, which
Mhm.
is also normal.
Happens.
Things change as we age, and we have to adjust to our new bodies as we age.
Mhm.
And so there are women who don't report sex for a year, or it could be a personal choice. I mean, we don't know why, or they could have the lack of a partner. They could be a
Yeah,
widow
that's what I was thinking.
and be grieving, or whatever, they're divorced and not be ready to date again. So there's a variety of reasons why women may go periods of time without having sex. And so we were just asking at this specific time, what would you say, over the last year? And so that's kind of why we have that drop. But for those who are responding, they're enjoying their sex lives.
And that's interesting. You said those who are responding. So I wonder, are the people who are responding the ones enjoying it? And maybe the people who aren't enjoying it, they just weren't responding. They're just like, oh, I don't want to talk about it.
And that could be the case too. And so that's another thing about data, right?
Yeah.
So, we have these samples of people who decide to participate in our data, in our research studies, and we kind of, we give them a blanket statement. It's about sex. If they don't want to participate, they don't. But
Yeah.
we do get enough people to be representative. We don't stop seeking out participants until we have enough women to show that it's representative of the same demographics that we see in the US using like the census and things. We don't know who, is more likely to respond and less likely to respond. So that's,
Hmm.
something that we keep in mind with our data. But again, for the women we have and the way they're responding, it is
That's some
positive.
good data.
It is positive, and we're excited about it.
Exactly. And you definitely hit on a lot as far as basically societal expectations and stereotypes with Black women. Like, are we expected to be hypersexual? Are we expected to be a certain way? And, that might create some internal conflicts or pressure regarding sexual expression. I know there was a trend where white men wanted to have sex with Black women because Black women were considered exotic. And it's just like, ooh, yeah, you're supposed to be a certain way in bed. So there's just lots of pressure that can create mental clutter. But then there's the physical issues as well, aging, or you might have a physical issue, or uterine prolapse might prevent you from wanting to have sex or being able to, or the discomfort or pain with sex. There's lots of different reasons. And you said the postpartum. After my first child, it probably took 3 months. The OB-GYN said I could have sex after 6 weeks, but I was just scared. I had a tear, and she said everything was just fine, but I was just still scared. So there's that. That adds to the mental clutter. It's like you the fears and things like that. But had I spoke to somebody, maybe that would have reduced that. But after the second child, it didn't take that long. But there's a lot of different reasons why we have this mental clutter. Caregiver stress, having to care for others, whether you're caring for aging parents or other family members, that creates mental exhaustion. And even though, and you're saying that most women are enjoying sex, what I would want to really promote is that sex can be a part of your self-care. So if you're stressed out and exhausted and don't have the energy for sexual engagement and it feels like a chore or it's stress, kind of flip that and think, well, wait, this is part of my self-care. Maybe I should, try to put that time in my day so that I can experience that pleasure because sex is healthy, especially if you're not having any of the physical issues. But any other data that you ran into, Dr. Towns?
So another thing that we don't often talk about is masturbation,
No,
whether
we
it's
don't.
solo or partnered. And so that is a sexual activity that is
Yeah.
in some form of sexual activity. And, so May is masturbation month. And so around
Is
May, we have,
it?
yeah, we have a lot of like sex educators who talk about it. And one of the benefits, so a benefit of sex in general, but a benefit of masturbation is also to relieve stress. Like some people who have a hard time falling asleep, or sometimes people who don't want to go through a prolonged amount of time with sex, which we really need to like break that down at another time of like how long sex should last and what the goal of sex should be.
Mm.
Like you don't have to, the end point of sex does not equal an orgasm. Like there can be just you enjoyed it, it's over, and move
Mm.
on.
I love it.
But I think we get tied into that an orgasm on either party or both parties has to happen in order for sex to be over. But one
Mhm.
way to kind of like change that dialogue is to think about masturbation. With masturbation, whether again, if it's solo or partnered or your partner is engaging with you, is that is a form of sexual
Yeah.
release. And so when we think about like mental health and like stress and clutter, one way to actually feel better
Uh-huh.
and release that tension or that stress that you're feeling is actually to have a sexual experience. Like you may think that you're not mentally there or
Hmm.
that you can't get there. And that
Hmm.
is very true. That is very real. And I'm sure you probably have some steps about or some tips about how
Yeah.
to remove those or block those things out. But if you get there and you're able to be aroused, then you can actually relieve that stress
Hmm.
during sex. And so that is something that can be a benefit to you. It can help you sleep if you're, like I said, struggling to sleep, struggling to function, struggling to concentrate,
Yeah.
fatigue. Sex can actually be the antidote to all of those
Exactly.
things.
That is true, especially if it's healthy and in, private, you're not out there like, okay, let me just
Consensual and all of those things, right?
consensual, exactly. Wow, there's so many directions to go in since you mentioned masturbation. I'm going to take in the religious direction because religion also creates a stigma with mental health in general because a lot of people think, oh, well, you just pray about it. You don't need to see a psychiatrist. And then on the other aspect, when you mentioned masturbation, there's a religious issue because a lot of people think, oh, is that a sin? Should I do it? And then if they do it, then that adds more pressure, mental clutter, stress, and all that. Woe is me. I'm a failure. I've sinned. And now God shames me. So that might create a lot if someone believes that. And maybe we don't have an answer because we're not here to tell people what to think and what to believe. But from a health standpoint, it's okay and it's healthy and it's a good release, stress reliever. Have,
Right.
have, have you come across that or has anyone asked you questions about that? Because how do you answer that without stepping on a religious toe?
Yeah, I mean, I think it really just is an individual, like from a
Yeah.
professional standpoint, it's definitely healthy. We definitely have so
Mhm.
many data and people who back it up that say that, sex and masturbation are both very healthy. Like even when you think about what it does for the body, like your blood flow is increased, you release endorphins, which makes you feel good. It's the same as like exercise, like this
Mhm.
you can feel after
A
exercise.
natural high.
It's the same way, correct, that you can feel after either engaging in sexual experiences or masturbation. And that is what is being promoted as far as a health standpoint. Now, when it comes to like what you believe and what you decide to engage in, that's the same for anything.
Yeah.
Like some people don't believe that the type of partners you have or the
Mm.
age of your partners or the race of your partners or the gender of your partners, like everyone
Mhm.
has their own individual beliefs. And so I'm not going to promote anything as it relates to that, but you
Yeah.
to kind of decide what's best for you. But like when people say that it's unhealthy, that's just not true.
Yeah.
From physical health, it's not true. Now, from a spiritual health or an emotional health, those are things you have to decide from an individual perspective. But yeah, it is actually healthy for you from
Mhm.
a physical standpoint.
Right. It's not like you're going to go blind if you masturbate.
Yeah, like you're not, your hands aren't gonna be
That was a
long
myth.
and, like things like that. It's just not factual.
So speaking of this, what about assistance with pleasure? So whether you're using some toys to masturbate with or as a couple, that's what you do. Is there any health hazards? And of course, we might as well throw in anal sex there too. I mean, is it what health hazards might be involved with anal sex or toys or both?
So there are no real health hazards as it relates to sexual toys. Like I actually had a paper I asked, well, I didn't ask, but the survey I asked Black men and women about their experiences with vibrators. In addition to like masturbation. And so, of course, we see a lot more Black women saying that they've used one before, either solo or with a partner. A lot less men saying that they use like a penis sleeve or something like that, but have used some sort of vibrators, perhaps with a partner. And so there are no health hazards. Like I've seen some myths out there too, like it'll desensitize your clitoris and that it'll,
Mm.
make you not lubricate if you use them too often. That's not true. Your body lubricates on its own, as part of the cycle of the sexual response. And so we go through that cycle of like, arousal and excitement,
Mhm.
plateau, orgasm, like all of these things. And so the sexual toy itself is not hazardous. Now, you do have to be cautious of like using them,
Yeah,
right? So make sure that they're clean, because that can be hazardous if you're using something that is not clean,
and
that
not
has
cleaning
bacteria
it.
on it, that you can get
Yeah.
an infection. So when it comes to like how to use them, then yeah, that you do want to be cautious about following the directions,
Mhm.
using the correct type of lube, because
Mhm.
some toys,
Mm.
the material that it's made of will work best with a water-based lube.
Okay.
Some toys work better with a silicone-based lube, which they tell you that on the box. Reading is fundamental. Read the instructions on the boxes. Make sure that you have cleansers, for your toy, that they're stored in the proper temperature or location that they say. And then, if you're using something else, like maybe like an anal bead or something like that, again, you want to be sure that you're reading the instructions because our anus does not have like a stopping point. Our vagina does.
Right.
The vagina is on the inside, the vulva
That's
is
a
on the
good
outside.
point.
So inside of our vagina, we have our cervix, which has
Yeah.
a stopping point. So any toy or penis that goes in there, it's only going to go so far because it's going to hit the cervix, and
Hmm.
it won't go past that. Our anus doesn't have that. It's connected to our intestines. So if you put something in there and it doesn't have a stopper or
Yeah.
string or something that you can control how
Yeah.
far it goes in there, it can stay in there and get lost. And there have
Hmm.
been hospitalizations of people who've used toys in their anus that didn't have a stopper
Oh,
or
wow.
string, and it got stuck and like lost in there because our intestines are like feet long that just
Yeah.
scrunch, together. And so that is something I would say that can be hazardous if you don't know that
Wow.
cautious. But as far as like using them, no, it's not
Okay.
going to ties. Yeah, but you do want to use the correct lube, and things like that.
That is really so about the intestine being as long as feet. People need to really know that because no one's really thinking about that. You and I think about that. We studied all of this, but that's a good point. I didn't even think about that from a hazard that it could get lost. You don't want that happening. Go all the way up. No, that's too far.
Mhm.
But yeah, yeah, yeah. This is real great material. Hopefully helping people kind of, relax as far as, not feeling the stigma of certain things that they might use or engage in sex because sex is healthy and it's for you to enjoy. Of course, it's to produce kids, but you're not going to have kids every time you have sex. So it's for you to enjoy. We just got to get to that place where we can relax. Because you did mention, well, before you mentioned lubes, you mentioned that we have a natural lube. Of course, some women may not be able to get to that point because they're just not mentally relaxed enough to get to that point. Or maybe they are on a medication that dries them out. And you went in to say about the lubes. So basically, it is okay to use. Is there any KY jelly, whatever one that's most healthiest, or they're all kind of pretty much fair
There's not,
game?
no, we don't really have, we wouldn't say that we would like prefer like
Yeah.
specific brands necessarily, but we do say that, water-based lubes are going to be really helpful for you because they're going to feel more natural. Silicone-based lubes, depending on, your makeup of like what's going on with your body. There are some lubes that also include, I don't want to say like a lidocaine, but some of them do have some pain relief. You experience pain.
Really?
There's vaginal
Wow.
moisturizers as well,
Oh,
that can
wow.
help with making sure that it's not going to be painful. Because for people who experience like chronic pain, significant pain during sex, they're going to probably use something a little different than someone who's just not in the mood and is just, needing some extra help, or maybe they get dry throughout the
Hmm.
sexual experience and just need a little extra umph.
Hmm.
And so those are going to be your water-based lubes. But again, you can like look these things up, like what's the difference between a water-based lube and a
Yeah.
silicone-based lube? And, are there, aloe lubes, and, there's so much stuff on the market. And so
Mhm.
before you use anything, I would definitely like look it up. There's CBD lubes that can help with relaxation and
Wow.
um, with pain as well, like pain management. So there's just so many different types, but you do want to, look and see what they are, what they're
Mhm.
saying they're going to do. And if you have any questions, like always talk to your doctor
Mhm.
about something. Because you also want to be careful, like some people have allergies, or, some of these products have irritants in them, and we may not know until we're using something. So if something is like burning when you use it, like a lube is burning, stop that immediately, right?
Mm.
Um, and look at the ingredients, because it could have something in there that you're allergic to, or something that is irritating you that can now cause an infection. Because if there's burning, then that muscle tissue can be irritated and inflamed, and
Wow.
skin is broken because there's friction during sex, and now you could get an infection. So you do want to be careful about like just trying things,
Hmm.
um, but there are different types of things out there for sure.
That's good to know. Well, let's kind of hit on trauma a little bit because trauma can be a reason or an obstacle that someone may not want to have sex, and that, of course, increases their mental clutter. And I'm here to say there is sex after trauma. Is there any research that you've done as far as trauma and sexual health?
So, not personally, but I will say that for anyone who has experienced any sort of like sexual trauma, I would definitely say to look into like a sex therapist. So, we have a whole sector of sexual health, sex therapy, where they focus on helping people identify what those traumas are and how to overcome those traumas.
Hmm.
And so, you think of like therapy in general and like how it helps you deal with like your life traumas. And you can work with I don't want to say like a regular therapist, but like you can work with a therapist,
A general therapist.
but there are specific types of therapists that
Yeah,
help work through sexual trauma or sexual challenges,
that's good to
sexual
know.
needs. Like if you're having an issue with sexual satisfaction or you aren't able to achieve an orgasm and your regular therapist just isn't able to help you, then you can seek out a sex therapist who is trained to help you work through your specific needs as it relates to sex. And so that's a lot of times anyone who's experienced either childhood or adulthood sexual trauma, whether it's from, a forcible rape or unconsent, things like
Mhm.
that, or even just bad experiences. A lot of times, sex therapy is something that is offered as a resource so that they can kind of work through that. And there are different types of coping mechanisms that are
Mhm.
offered, different types of treatment plans, depending on the issue and the nature and the severity of the trauma itself. There may be, different recommendations of how to work through that.
It's
I mean,
really
some
good to
people
know.
have trauma after childbirth. Like some
Yeah,
people's childbirth their experience is so traumatic.
traumatizing.
I mean, you talked about tearing, but I mean, like from a physical standpoint, the way they were treated, what
Mhm.
their body went through, how they feel
Mhm.
about their bodies, the healing
Body
process.
image issues after having a baby. Or if you have
Yeah,
a
like all of
C-section
those
and you have
things.
that scar. Oh, yeah, there could be a
All
lot.
of those things, in addition to how your body is responding, like, after childbirth, you do experience vaginal dryness. And, some people are just
Yeah.
not happy with where their vaginas look after childbirth. Like, there's just so many things. And so, seeking some sort of professional to talk through and work through these things so you
Mhm.
don't feel alone and so that you don't feel like you're the only one going through this
You
and
are
that there.
never the only one. Talk to another lady who's had a baby.
Yeah, like, those are the things that, you can do because it's really hard when you think about like research because everyone's
Yeah.
experience is different.
Yeah.
But, talking to someone where that's their job to just like help you navigate and work through it, that's going to help you feel better about yourself and make you maybe, reconsider like having sex again or what does sex look like now?
Mhm.
It may not look like what it was prior to.
Yeah. Or it might be even better. Who knows?
Yeah, it could
But
be
yeah,
better. You can try different things.
seeking help, sex therapists, regular therapists that you mentioned, or counselor definitely can help you work through whatever stress, trauma, body image issues, depression, balancing work issues to get you there. And sex can be a part of your self-care and is a part of your self-care, but also you need to prioritize self-care to get to the sex as well. At least for some people, a lot of people, or some people can't turn it off, some people can. It seems like men can turn off whatever stress they might have more readily than us women can. But prioritizing your self-care, I've talked about self-care before months back. Look at that podcast episode: exercise, meditation, relaxation techniques, pursuing hobbies, getting your me time, taking vacation, whatever it is, a massage, whatever it is you need for yourself, get to that point. And also talking to your spouse, talking to your partner. If you're going through something with sex and not being able to, not having the pleasure, it's okay. They're not going to get offended. And if they do get offended, that's a whole nother issue. But be open with your spouse. Like, this is what I prefer. Talk to them, talk about it. And then maybe they can help you improve or you guys improve together. So I think that's very important.
Yeah. And even if things have changed, like if you want to like pause on something or like, this position used to feel good, it doesn't feel good anymore. Like it hurts. This is
Mhm.
uncomfortable. Like, I need extra support with pillows because I thought I could bend this way and I can't anymore. Like even just things that you used to be able to do that now you're not able to, even if it's for a short period of time, like if you experience different things of life, like, for me, I was in two car accidents.
Mm.
I recently lost my dad. Like all of those things have changed the way I think about life in general. But even just when you think about like the things like someone like for instance, someone is in a car accident and they're in pain, they may not be able to do certain things that they were
Yeah.
able to do before because they're navigating that. And it may not change how they want to engage with their partner, but it may change what they're able to do during that period of time,
Hmm.
and just being flexible. But you have to communicate that. Like, people are not mind readers. And so,
Correct.
tell people, like tell people, your partners that what you're able to do, what you're comfortable doing, they should accommodate and be flexible with you. And if not, then you have to rethink that that partnership or that sexual
Yeah.
relationship because again, pleasure should be the center, the focal point. And if it's not, then like, why are you
Right. You
deciding to do
with
it?
them. Exactly. Yeah. They should want to have you experience pleasure too. It's not, it's equal.
Yeah, it's not one-sided. It shouldn't be one-sided. Some people are in relationships where it is one-sided, and I
Yeah.
really want to encourage you to really think about that. Like, how do you feel about that, and what would make you feel better? But yeah, it shouldn't be one-sided, and it should be like a
Collaborative effort. I love it.
collaborative effort that is mutually beneficial.
Yeah, open communication. If you need couples therapy to be able to have that communication, hey, it helps. But practicing mindfulness and just being present in the moment, and that's with any daily activity, being able to have some grounding techniques to get you to be present in the moment, experiencing that sex and get rid of that mental clutter. But in general, being able to, whether it's relaxation techniques, journaling, whatever it is that you might practice, increasing.
Candles, turn the lights down, to block things
Exactly.
out, like whatever works for you.
Hmm.
Walking,
Hmm.
whatever it is, to just woosah,
And
like
challenging negative thoughts. We have a lot of negative thoughts like, oh, I've been breastfeeding, my boobs are droopy. Like you said, I don't like the way my vagina looks, this, that, and the other. But challenging those negative thoughts and replacing them with positive affirmations.
absolutely. I
Yeah,
love that.
that'll get you there too. Well, we can just talk on and on about this sex. I'm so glad I had you here, Dr. Towns. But like I said, sex can be a part of your self care, and it also requires self care for some people to get to that point. So I hope this is helpful. Make sure you engage in your self care, positive affirmations, exercise, got to push that. And then at the end of the day, if you need to seek help, whether that is a therapist, primary care physician if there's any physical issues going on, or a psychiatrist, go and get that help. Any last words, Dr. Towns?
No, I thought you summed it up really well.
Yay! Well, thanks for coming on the Journey to Joy live show. I ask everybody, what does joy mean to you? You're on a Journey to Joy live show. So, what does joy mean to you, Dr. Towns?
Ooh, that's good. I am like refinding joy. Like I said, I just lost my dad a few months ago. And so for me, it's just like calmness, even just like feeling like the sun on my skin. It's just paying attention to the small things. I think that is what joy is to me
Mm.
because life is always happening around us. I think the term people say now is like life is lifing. And that
Mhm.
will always happen. But like really, for me, joy is like finding like the small things that can just make me appreciate the life that I have and the blessings that I have. And so even if it's, taking a walk and just feeling the sun on my skin, even if it's cloudy, but like
Yeah.
it just peeks out for a little small second, like that's joy.
Yes.
Looking around my house and seeing the things that I have compared to how I grew up, that's joy. So it's really just like pausing for a second to just be grateful, like
Mhm.
really practicing
Mhm.
gratitude. That is how I have been like looking at joy at this phase of life. I think before it was like going on trips and spending money, and
That's
now it's
true.
really just like being
Right.
grateful for what I have, who I have, and like that to me is like where I'm at as far as joy.
That is awesome. I loved how you defined that because joy means different things to different people. All right. Well, thank you so much. Thanks for watching episode 31 of Journey to Joy Live.